The number of abortions in the UK is on the rise. I'm Olly Mann, and this is The Week Unwrapped. Harriet, what's the story?
This week, the ONS published their official figures on abortion rates in England and Wales in 2022, which showed that the percentage of conceptions that ended in abortion was nearly 30%, which is a 13.1% increase on the 2021 figures. And it's up from just over 20% in 2012. So we're talking about quite a substantial increase in the rates of abortion. Now, this is confirmation of figures that were published at the end of last year by the government, which also showed that the number of abortions reached record high in 2022. It's just the two data sets are based on slightly different metrics. Like one is based on the estimated date of conception and the government figures on the date of abortion. So the numbers are a little different, but the overall picture is of record high rates of abortion in England and Wales.
Okay. Incidentally, just on that data point, why are we getting data that's 3 years old anyway? Why is it 2022 that's being looked at rather than 2023 or 2024? Do you know?
It takes a while for this type of data to become available. Like, obviously, we're talking about abortions that are done either through the NHS, through private healthcare, through prescribed medication, through surgical intervention. There's lots of different ways in which the data on abortion can be collected, and it's not so simple. These two sets of data together represent the kind of most recent and broadly the most accurate picture of the rates of abortion in England and Wales that we have.
Why do we think the numbers are going up? Jamie?
I mean, obviously the cost of living crisis is one of the issues. Many women facing kind of financial constraints, unable to afford the costs associated potentially with raising a child, leading them to choose abortion. Access to contraception is obviously another issue. Lengthy waiting times for contraceptive appointments, difficulties accessing specific types of contraception, particularly non-hormonal options. A lot of people are choosing to move away from things like the pill because it hasn't been affecting them in the ways that they want it to.
And Felicity, there's also access to the morning after pill, isn't there? Like, that is something that campaigners say needs to be more easily available.
I'm sure that's true. I think also COVID had quite a lot to do with this. I think under COVID, it was very difficult to procure an abortion, and that's why pills being sent by post became more popular. And I wonder whether that kind of accessibility and convenience has made abortions more popular. I also, just listening to Lily Allen and Makita Oliver, I wonder whether there is actually just a cultural shift in attitudes and views underway, that we're just a lot more relaxed now about abortion. You can see with the recent vote by the Commons to decriminalise abortion in this country right the way up to term, drastically changing the law on abortion in this country and making late stage abortions possible, although you're not allowed to help someone have an abortion, so it would still be illegal for a doctor. But in terms of if you wanted to take pills to terminate your pregnancy at any point, you can now do so without facing prosecution. That's a huge shift.
Yeah, even the campaigners on that change, Harriet, would admit that it's maybe not what most people in the country want, but they say that, you know, criminalising women for having an abortion under any circumstances is just the wrong thing to do, and that's why the change is going through Parliament. It is slightly under-discussed, isn't it, considering it's such a big social issue. We all focused on the right to die stuff, and the abortion stuff didn't get as debated, frankly.
Well, just to be clear, I think a lot of people don't realise that up until this year, abortion was still illegal in England and Wales, but it was permitted up until 24 weeks of pregnancy, and beyond that in certain circumstances, such as if the woman's life was in danger. But women were increasingly getting prosecuted for ending their pregnancies outside of that 24-week period, using this kind of Victorian era law, which is still in force today, the 1861 Offences Against the Persons Act, under which there's still criminalisation of abortion. And then what happened was last month, MPs voted in this landslide vote to decriminalise the procedure. The Labour MP Tonia Antoniazzi tabled this amendment to the Crime and Policing Bill. So not to the Abortion Act, not to the Offences Against the Person Act, but the Crime and Policing Bill, which effectively meant that any woman who now gets an abortion outside of that still existing 24-week limit will no longer run the risk of being investigated by the police. But obviously, there have been some criticisms about this tabled amendment, which still has to go through the Commons and the Lords. It doesn't actually change any existing abortion law, which is why obviously we're not talking about it in the same way as we are the right to die bill. It is not changing any abortion law. also, anyone who helps a woman get an abortion outside of that 24-week framework, so like doctors, for example, can still be penalised. So for women who want an abortion outside the 24-week limit, how safe is it? Like, technically it's legal, but there's no actual way to access one safely via a medical professional. And that's why people like Stella Creasy are actually putting forward another amendment, urging MPs to go further and ditch any abortion-related clauses of the Offences Against the Person Act and enshrine abortion as a human right. Now, in terms of what the public view on these matters is, as soon as you get into the weeds of what the law actually is and who can be prosecuted for what, there is also widespread ignorance of the legal situation too. So I think that's worth saying.
There are also concerns, aren't there, Jamie, that the law change still poses risk to women, a different risk to women, in the name of coercion to have an abortion. There might be people who didn't want one, and that's why they didn't get one earlier, and then late in the pregnancy are coerced into doing so.
I think the discussion around it was actually really quite toxic and quite kind of concerning and worrying. Jacob Rees-Mogg went on GB News and lambasted a cult of death that this amendment was bringing in. And I think a lot of the worries were about, as Harriet was saying, people not quite understanding it, and potentially also whether the kind of US debate could end up arriving over here. And I think some of the stuff around that is interesting. Certainly Rachel Clark, who's head of advocacy at the British Pregnancy Advisory Service, she said that she thought there was something pretty inherently British about going, well, I might disagree, but it's not really my business. And actually that the debate in the US is quite different from the debate to the UK, primarily because of the role of religion and how much more religious the average person on the street is in America than in the UK. But what was interesting was how Stella Creasy wanted to propose a lock on ministers, stopping future politicians from reducing access to abortion in the future. And actually the campaigners, such as the British Pregnancy Advisory Service, they kind of didn't want her to do that and didn't support that lock because they saw it as the beginnings of the culture war. And they kind of thought, actually, we're not there yet in the UK. And so by doing that, you might end up in a situation where further down the line, someone says, well, they're trying to do this, so we need to do that.
I think Stella Creasy partly was talking about the lock in a response to Nigel Farage, who she is worried that we could have a reform government at some point. And Farage has been quite outspoken that he thinks the current 24-week limit is too late, basically, and he would want to reduce that, which is interesting because actually the 24-week abortion limit, the reduction of that is actually supported by 70% of women in this country, which again I think possibly shows that the Commons are out of touch and out of step with what people in this country feel about abortion. And what I would say about the 24-week limit is that I think it was a compromise that we reached in this country. A lot of people still think 24 weeks is still way too late, but I think we had reached a kind of wary compromise between both sides of this, that we were happy with this and that we could live with this. I think what the Commons have done by voting to decriminalise is massively change that debate. And I do think there is going to be a backlash because I think a lot of people are unhappy about this. I know from anecdotal experience, when you talk to parents who see the 24-week scan and see that there is a fetus which looks very much like a baby, people already think, like, they already have problems with that. They already have qualms with that. And I think, this is literally a life and death issue that I think we're almost now saying in this country is like a settled issue, that we all agree on this. And I just don't think that's the case.
I think that's a bit misrepresentative of why this amendment was tabled. This amendment wasn't tabled to settle an argument about the abortion limit being 24 weeks. To be clear, nearly 99% of abortions happen before a pregnancy reaches 20 weeks. So that is just like a fact.
I agree. And I also think it's extremely unlikely anyone would want to go a late stage abortion, because for yourself, that would be extremely traumatic thing to go through, right? So I completely agree that I think it's very unlikely that someone who is 8 months pregnant is just going to casually take some pills because they don't want the pregnancy, whatever reason. But in some ways, I don't think that's relevant, because what I think you're still saying as a society, as a country, is that in theory, though, we're actually okay for that to happen if it did happen. And I think that is really worrying. And I think a lot of people aren't okay with that.
Well, actually, what it was more to do with was to do with the increase in women who were being investigated over suspected illegal abortions in the past 5 years. And that is an astonishing increase. About 100 women are believed to have been investigated over these so-called illegal abortions in the last 5 years. And before that, I think only 3 women were thought to have been prosecuted since abortion was first made illegal in 1861. So we're talking about a real increase in the so-called criminal investigations that were by many people considered to just be almost pointlessly cruel. For example, the case of Nicola Parker, who was taken from a hospital to a police cell after she took prescribed abortion medication at about 26 weeks of pregnancy, when she had believed that she was no more than 10 weeks pregnant. And she was cleared of illegally terminating her pregnancy, but she was subjected to like 4 years of criminal proceedings. And this is not the only such case. I mean, there was a teenager who she had 6 years of criminal proceedings after she had an abortion and gave birth to a stillbirth. So I think that this tabled amendment to the crime and policing bill, not to any existing abortion legislation, is much more to do with a sort of response to this increase in criminal proceedings that is actually, a lot of people believe, is to do with the influx of money and influence from anti-abortion activists from the US. So the success of the anti-abortion agenda in the US is very much invigorating and providing funding for similar activists in the UK as well. So this isn't necessarily about what the public believes as much as it is to do with combating a rise of criminalisation.
Yes, but it would be weird, wouldn't it, for it to be a subject that passes completely without comment or completely uncontroversially. I mean, sort of as we're demonstrating, people have views on this. And actually, if you look around the world, it's hard to think of a country where you'd say, well, they've settled it, they've sorted it, they've quieted in their lobbies. Like, it is a thing that gets people involved.
No, and I think it's worth saying that, like, only 1%, I think, is the most recent figure we have. Only 1% of British people support the right to a late-stage abortion. But 70% of MPs think that women shouldn't be liable for prison services if they have abortions outside of restriction. So it's not to say that we're saying that MPs think that it's right. We're saying that they think they shouldn't be criminally punished for it.
I mean, to take it back to the statistics we were talking about at the top of this item, with all of this going on, do you think the statistics are going to continue to climb? Are we going to see more abortions, legal or otherwise, in the years ahead?
I do, yeah. I do think this is the start of an upward trend of more abortions supported by this recent decriminalisation. I think when you start to decriminalise things, you start to normalise things. I think just the fact that the story seemed to me to really pass under the radar. I have a lot of friends and family who had absolutely no idea that this had even happened, was really, really crazy. So I think there is a shift is underway. I think we will see more abortions. And I think for some people, for a lot of people, they find that really, really troubling.
Harriet.
Well, I think what ties together the statistics of this week and the amendments to the legislation of last month is there is a vast discrepancy between the legislative situation, like what is legally your right, what are you legally allowed to do, but what might you be criminalised for, and the actual reality of access. So part of the reason that there is this rising rate of abortion is to do with the difficulty accessing emergency contraception. And part of the reason that there is all of these legislative changes is because of the difficulty of accessing abortion. So I think we always have to bear in mind that in every case that we have, in every data set we have, in every country we look at, when you limit access, you actually do not decrease the rate of abortion. What you do is increase the danger to women.